In the South Bay, doctors are raising concerns over the rise in gastrointestinal illnesses due to the sewage crisis. And a local clinic says they are preparing for the influx of people who may get sick after walking through floodwaters. Our Kasha Gregorczyk is joining us live to explain. Kasha.
Hey, good evening, Kathleen. Well, that heavy rainfall and flooding was just over a week ago. The doctors here say the incubation period for some of these bacterial infections like E. coli can be anywhere from 1 to 10 days. So with more rain on the way, they fear this may just be the beginning.
Here again, we had a big rain, and now we're starting to see a big increase in people with vomiting and diarrhea and abdominal pain. It's happening again.
Doctors Matthew and Kimberly Dixon, who run South Bay Urgent Care, have been sounding the alarm since last fall on the heels of Hurricane Hilary, when they reported seeing a massive spike in diarrhea-related illness.
Normally we'd see about 4 patients a week with diarrhea, and it went up to
34.
Yeah.
So
situated so close to the border, they say a storm or a sewage spill easily triggers a rise in patient visits. So they began running specific testing over the last several months.
We knew people were getting sick. Now we know which bacteria can be causing it, which is the Campylobacter, the E. coli, Salmonella, Shigella.
Illnesses that are common in third world countries now potentially becoming the norm locally.
whenever you have a closed sewer system like we have everywhere in the United States except for here, you should not see these kind of bacterial infections. They're very rare.
The doctors are waiting on official lab results from a lot of patients within the last week, but after seeing people with the same symptoms along with dramatic images of people wading through the sewage contaminated floodwater, they're now hoping to raise awareness.
If you start having abdominal pain, fever, blood in your stool, those are all signs they can be a more serious and potentially life-threatening injury. We do encourage patients, if they have been in the South Bay exposed to any of this, to definitely go see their doctor and get tested to find out, is it a more serious infection?
Now, the doctors have shared their data from the last few months with the CDC as well as local and state health officials, but have yet to hear back. In the meantime, with more rainfall and potential flooding on the way, they say really their best health advice is to stay on top of your hygiene as best as possible. Wash your hands, wash your clothes if they become contaminated. And if you find yourself in a position where you are cleaning up after the flooding, wear gloves as much as possible. Reporting live near Imperial Beach, Kasha Gregorczyk, Fox 5 News.